installed 2 overhead water tanks at the community's health center. The team also provided further maintenance work on some faulty equipment at the health facility, including repairing of malfunctioning sinks and the water supply system. The intervention by the Dutch Foundation was welcome and appreciated by the residents of the village. Hundreds of people, including health workers, community members, and the country's development partners, Thursday descended on Balangar in the Central River region to commemorate World Malaria Day. The event, held on the theme Invest in the Future, Defeat Malaria, was punctuated by calls for greater collaboration in the fight against malaria. Details in this report. World Malaria Day celebrations in Balangar, Kernder. The event in the Central River Region settlement came at a time when the mosquito-borne disease is reported to be on the decline, but with the African continent still bearing the brunt of malaria. Authorities in the Gambia are vigorously engaging all stakeholders, particularly rural communities, in the anti-malaria crusade. Chief Aligay Ture of Lower Fladu District said the occasion was in their best interest, for it is withheld that peace itself can be nurtured. Chief Gay spoke on his people's resolve to actively partake in the monthly cleansing exercise in the quest for a decent and disease-free environment. The region's Director of Health Services, Jankoba Jabi, credited the indoor residual spraying and National Cleanup Days as 2 effective interventions that have made a difference in the fight against malaria.
These interventions embrace widespread universal access to long-lasting insecticide nets, prompt and effective case management, indoor residual spraying, intermittent preventive treatment in pregnancy, and evidence-based information, education, and behavioral change communication, amongst others. In conclusion, access to prompt diagnosis and treatment of malaria is being scaled up through community case management of malaria.
World Malaria Day, according to Balakande of the National Malaria Control Program, presents a chance for all to make a difference in rolling back malaria, saying his institution has gone far in building partnerships with critical players in that direction.
This partnership has been and remains strong in the Gambia, but we all know there is still need and plenty of room for other sectors to join and help combat malaria. The private sector in the Gambia, I would like to call upon the private sector in the Gambia to join upon the malaria fight, so as to help mobilize the much needed resources in order to fight, because you know government alone cannot do it. In the Gambia, we already recognize the fact that a robust partnership is in place, and that is uniting all partners and stakeholders in malaria control to respond to the challenges that no other organization can do it alone, and individual cannot do it alone. In conclusion, Mr. Chair, distinguished guests, ladies and gentlemen, I would like to urge all stakeholders to redouble our efforts in the fight against malaria by nurturing and strengthening the RBM partnership.
Governor Gani Ture, for his part, said the theme is just fitting as malaria continues to hinder our development aspirations.
Controlling and preventing malaria requires a collaborative effort from all sectors of the society. No single person or unit can do it alone. Therefore, community leaders can help in great deal in advocacy, social mobilization, campaigns, and showcase the efforts made against combating this disease.
Dr. Samila Jah, who stepped in for the WHO country representative at the event, said the theme Invest in the Future, Defeat Malaria reflects the need for firm accelerated action as the MDG target year of 2015 ever inches closer.
We must not forget that 90% of the 660,000 malaria deaths reported last year occurred in Africa, and that malaria kills 1 African child every minute. Increased domestic and external funding is needed to ensure that adequate quantities of commodities, including enough long-lasting insecticide-treated nets, insecticides, rapid tests, microscopes, reagents, and anti-malaria drugs are accessible and used rationally. Integrated delivery of anti-malarial actions with maternal and child health, immunization, hygiene, sanitization, and improved housing programs must be expanded in order to defeat malaria.
Balagaba Jahumpa, the Minister of Health and Social Welfare, touched on the importance of investing in the fight against malaria and the health sector in general, making reference to the adage that a healthy nation is a wealthy one.
Here in the Gambia, under the National Malaria Control Program, we have established mechanisms and strategies so that Gambians have access, so that you can be tested for the disease, diagnose and have treatment against malaria. The National Malaria Control Program have also programs and strategies for treated nets. Therefore, we appeal to Gambians, especially women and children, to use the treated nets. The National Malaria Control Program also has an educational program in order to sensitize the population against the disease.
The health minister, who also applauded the country's leadership for its strong commitment to the fight against malaria, disclosed that his ministry is working on plans to embark on a massive fumigation campaign of swamps throughout the country, all in an attempt to make the Gambia a disease-free nation. Famara Fofana, GRTS.
We'll be back with news from outside the Gambia after this break. President Barack Obama says the U.S. will conduct a vigorous investigation into whether Syria used chemical weapons. Mr. Obama met with Jordan's King Abdullah Friday. He says the U.S. has to act prudently, but it cannot stand by and permit the use of chemical weapons on civilians. This is not the first time the Syrian government has been suspected of using chemical weapons. CNN's Pentagon correspondent Barbara Starr has more on that.
March 19th, Aleppo, Syria. There is talk civilians here have been attacked with chemical weapons, but no confirmation. Now, suddenly, Defense Secretary Chuck Hagel traveling in the Middle East.
The U.S. intelligence community assesses with some degree of varying confidence that the Syrian regime has used chemical weapons on a small scale in Syria, specifically the chemical agent sarin.
The White House sent letters to Congress responding to questions about chemical weapons use and calling for a UN investigation. After the debacle over Iraqi weapons, Hagel says the U.S. needs to confirm exactly what happened.
We need all the facts. We need all the information.
Senator John McCain told CNN's Jake Tapper it's not the response he wants.
A disappointment, but not surprise. The president has not wanted to engage in Syria in any way, any meaningful way, for a couple of years.
McCain wants a no-fly zone, weapons provided to the Syrian opposition, and chemical weapons secured. President Obama had promised action, but was never specific.
A red line for us is we start seeing a whole bunch of chemical weapons moving around or being utilized. That would change my calculus.
A senior U.S. official says the Syrians continue moving chemical stockpiles, causing even more worry. Hagel is sending the 1st Armored Division's headquarters from Fort Bliss, Texas, to Jordan. The official tells CNN it will spearhead securing Syria's weapons if ordered.
We could use airstrikes, drone strikes. There could be teams of special forces who go into the country.
But the chairman of the Joint Chiefs of Staff, who is reviewing military options, says troops aren't the answer.
You have confidence that we could secure it?
Not as I sit here today, simply because they've been moving it.